Hi, this is Owen Peller, and I'm a cardiologist with AssociatesMD. I'm here to talk to you a little bit about COVID-19, or the new coronavirus, and its interaction with cardiovascular disease. Now, as you know, or as you may know, a lot of people have absolutely no symptoms. And this is part of the problem because people with no symptoms can still transmit the disease to other people. It may turn out that this is one of the main sources of transmission to other people. Now, of people who do have disease, most of the time it's fairly mild. People have a cough, a fever, shortness of breath, some muscle aches, some fatigue, sometimes a little diarrhea. Typical symptoms of many viruses. And in the early stage of disease, it may be impossible clinically to know whether someone has the coronavirus or someone has another viral illness. Now, unfortunately, there are people, probably 15% of people, who don't have mild disease, but they have moderate or severe disease. And moderate or severe disease often will require hospitalization, but not always. People who have this condition have pneumonia oftentimes, which can progress to a diffuse involvement of both lungs, called ARDS, and some of the time it leads to death. The elderly, especially people who have pre-existing medical conditions, are more likely to have moderate or severe disease, but many elderly still only have mild or moderate disease. Severe disease is very uncommon in children, although it does happen. Now, people with pre-existing cardiovascular disease are also at increased risk of severe disease and death. This is independent of whether they're elderly. Of course, people who are elderly both are elderly and often have cardiovascular disease. The reason for this is somewhat unclear, but probably it's related to decreased immune function in people who are elderly and in people who have cardiovascular disease. So, for example, in China, in the area where the disease first started, the overall death rate that was reported was 2.3%. However, in people with pre-existing cardiovascular disease, the death rate was 10.5%. In people with diabetes, it was 7.3%. And even in people with only high blood pressure, it was elevated at 6%, which was 3 times as high as in people without hypertension. Of course, people can also have cardiovascular disease, diabetes, and hypertension, since these also go together, and the incidence of severe disease and death is much higher in people with more than one of these conditions. COVID-19, or the coronavirus, can specifically affect the heart, although the primary site of damage appears to be the lungs. The virus can infect the heart as well as the kidneys. And in people with severe disease, heart involvement becomes much more common. So, for example, in people in the intensive care unit, about a quarter of those people have heart involvement. And the heart involvement is due to injury by the virus and perhaps injury caused by the immune system in response to the virus. So there are increased cardiac enzymes like you would see in a heart attack, which occur with severe coronavirus disease. You can also get congestive heart failure, and if someone already has congestive heart failure, it can be worsened. Occasionally, the symptoms of the coronavirus can mimic what you would see with an acute heart attack. You can also get arrhythmias, or abnormal heart beating, associated with the coronavirus. And also, you can get arrhythmias from the treatment or some of the treatments being used for coronavirus. Now, there really are no definite treatments for the condition. The way we deal with it is supportive care. However, in patients who are not enrolled in clinical trials, a lot of doctors are using hydroxychloroquine, often in combination with Zithromax or azithromycin, in people who have moderate or severe disease. In the local hospital implantation, this seems to have become a standard of care, although there really is no great evidence that it helps. But oftentimes it's used because there is some anecdotal evidence that it seems to help. Unfortunately, both hydroxychloroquine and azithromycin, both of those can lead to arrhythmias individually, and when the drugs are used together, the incidence of severe arrhythmias and even sudden death is going to be enhanced. Deep vein thrombosis is another complication of coronavirus disease. It's a cardiovascular condition that is increased in frequency. Another way the coronavirus can interact with the cardiovascular disease spectrum is that people may not seek care for their cardiac symptoms because of concern about getting disease or getting coronavirus when they go for treatment of their cardiac disease. This may involve not coming to the office when they should, or not coming to the hospital when they should. So you can have someone, for example, with significant heart failure or someone with chest pain who is having a heart attack who doesn't come to the hospital because he doesn't want to get coronavirus. And of course that can lead to a worse outcome. Now, in addition to changes in patient behavior, there are also changes in the behavior of the healthcare system. So, cardiac care in some cases may not be as readily available in the era of coronavirus. Now, hospitals by and large are going to treat heart attacks the way they would treat them anyway. However, because of the constant concern for coronavirus, people who have atypical symptoms, or let's say someone who has a heart attack who happens to have a fever, may not get as prompt treatment or may not even get appropriate treatment because of confusion about the possibility of coronavirus as either an additional condition or as the only condition going on. The other thing that we see is that elective heart procedures are not being performed, and that's on the advice of the government and also the local healthcare system. The idea being that we don't want to use more of the personal protective gear than we have to, and we don't want to expose people to the hospital or outpatient clinics more than we have to. The problem is what truly is elective, and some cardiac procedures are being called elective that probably are not totally elective, and people are most likely having cardiac complications of their cardiac disease because procedures such as stenting or even in some cases bypass surgery are being delayed or not done due to concerns about the coronavirus. Potential treatments, again, there are no treatments, but potential treatments for coronavirus can affect the cardiac system. As I said, hydroxychloroquine and Zithromax are often being used off-label to treat the condition with very thin evidence that they help. Both of these drugs individually and together can cause changes in the conduction system of the heart and can cause cardiac arrhythmias and even death. Also, hydroxychloroquine can cause direct toxicity to the heart, usually in higher doses than are being given. However, in some of the clinical testing for this drug, higher doses were given and they found that there was cardiac toxicity. There's a little bit of controversy about the use of steroids. Steroids cut inflammation, and part of the reaction to the coronavirus that causes injury in a person may be related to inflammation and the inflammatory response. So at first, steroids were used quite a bit. But then it seemed that at least some of the time steroids made things worse. So although I believe steroids are still being tested, at this point we are not giving steroids to treat this condition. The non-steroidal anti-inflammatory drugs like ibuprofen, Motrin, Indocin, Voltaren, and others probably shouldn't be used. There's a suggestion that they may make things worse. It's not clear that they do, but because of concern that they may make things worse, and certainly no evidence that they make things better, it's not a good idea to use those drugs. There are other drugs being looked at experimentally which aren't available. There's been some positive publicity lately about remdesivir, which is an antiviral drug that may help. It's still in clinical trials. It's an intravenous drug, and it at this point does not appear to have significant cardiac toxicity. So to summarize, coronavirus can be asymptomatic, mildly symptomatic, moderately symptomatic, or severely symptomatic. It can cause death. In people who have pre-existing cardiac conditions, the incidence of moderate and severe disease is worse, and the incidence of death is higher. Some of the treatments or potential treatments for the condition can potentially cause heart problems, and some of the symptoms of the condition can mimic heart disease and result in either delayed or treatment that isn't given altogether. And elective heart procedures that are not truly elective are being deferred, which can also result in significant additional morbidity and mortality. Good luck. Hopefully we'll come up with a cure and a vaccine in not too long a time, but who knows.